This talk on Parkinson's and the eyes through the lens of a geriatrician is very much aimed at people with Parkinson's, their carers and their families. I'm hoping to convey a general overview and a few practical tips. During a consultation, when asking someone with Parkinson's about their vision, it is not unusual to have a reply, but I didn't know that Parkinson's had anything to do with my vision. Chowdhury in 2010 reported that when non-motor symptoms are explored, it is not uncommon to discover visual problems which haven't been declared. Bastiaan Blom's group in the Netherlands mentioned that patients may not complain about their posture till it interferes with their vision or mobility. The visual pathway is complex and requires the eyes to function well and align with each other, but also communicate with an elaborate network through the rest of the brain. When the eyes and the network are working well, we are able to look at stationary objects and register detail, move our eyes between objects, and follow objects without any difficulty. Eyes may be affected in Parkinson's from the disease process. This is usually, but not always, related to a lack of dopamine in the brain and in the retina in the eye. In addition, a flexed posture means that there's a tendency to look downwards rather than forwards, and spectacles and lenses may not fit as well. Levodopa, which is present in Sinemet and Madapar, can worsen glaucoma. Parkinson's is more prevalent in older people, and therefore there may be age-related changes in the eyes like macular degeneration and cataracts. Other medical problems like diabetes and strokes may also affect vision. The commonest eye problem in Parkinson's is the dry eye. The tear film protects the eye and is the first layer that comes into contact with light. Reduced blinking means the tears are not evenly spread and may result in blurring. The eyes may feel gritty, uncomfortable, and painful. There may also be excessive tearing. If you have these symptoms, see your optometrist first. Artificial tears may help, and do make sure that you have a good liquid intake. Parkinson's is not known to affect eye pressures directly, but Madapar and Sinemet may increase eye pressure and worsen existing glaucoma. This is not usually serious, but your optometrist and ophthalmologist need to know that you have Parkinson's, especially when medication is being commenced. With Parkinson's, there may be impaired color vision and also reduced contrast sensitivity, which is the ability to distinguish between objects and the background. Eye movements may be affected, and commonly the inward movement of eyes, which is called convergence, may be impaired, and this can lead to difficulty in reading. Specialized testing can show a slowness or reduction in the range of movements of the eyes. Double vision can also occur. Sometimes people with Parkinson's may have visual hallucinations, where they see objects or people who are not really present. In the Parkinsonian syndromes like progressive supranuclear palsy, there are special problems with vertical gaze, that is in looking up and down, but also sensitivity to light, which may result in spasm of the eyelids. This is called blepharospasm, which may also occur in Parkinson's. Botox injections into the eyelids may help. In the general population, cataract extraction has been found to reduce the frequency of falls. Falls in people with Parkinson's is common, and the reasons complex, and these would include freezing, motor symptoms, as well as visual problems. The success of cataract extraction is also less predictable, as there may be other pathology in the eyes, in the optic tracts, and the pathways. It is important, if you have a problem with your vision, that you tell your family, your GP, your Parkinson's educator, your optometrist. Also make sure that you keep regular appointments with the optometrist every 1 to 2 years. Simple treatments may be available, or they may suggest referral to other specialists. As regards your Parkinson's medication, your specialist may suggest an increase in Sinemet or Madapar for some visual problems. But if there are troublesome hallucinations, some of your medication may need to be reduced. There is much more work to be done in working out the causes and effective treatments of visual problems in Parkinson's, but there are some simple remedies that could help. Looking after your vision is important in helping you to have the best quality of life. Thank you.